Alcohol. You see it everywhere. In the supermarket aisles, people heading to the pub after work for a beer with their mates, or cocktails on a Saturday night. Or you may have seen family members drink it at home. This is normal.
No, it's not that.
This is normal.
No, it's not that.
And that's because this is normal. In fact, it's a really big part of life. However, alcohol abuse and misuse means drinking excessively on a regular basis. All alcoholic drinks contains alcohol, but they are all a bit different, and any drink container has to tell you how much alcohol is in the bottle. Every year, harmful use of alcohol is responsible for 3 million deaths and 5% of global health burden, from road traffic injuries to violence, abuse, and neglect, to diseases like liver cirrhosis, heart diseases, cancer, and tuberculosis, to mental health issues like alcohol dependence, depression, and suicides. Alcohol in alcoholic drinks is a chemical called ethanol. And ethanol is produced as a waste product when a fungus, called yeast, eats sugar in the process called fermentation. Once it's consumed, alcohol goes down the normal path of digestion, from the mouth through the esophagus and into the stomach. About 20% of alcohol is absorbed through the stomach lining into the bloodstream. One note here, if there is no food in the stomach, or if the alcohol is not consumed with any food, excess alcohol will be absorbed faster into the bloodstream and travels to the liver to eventually eliminate it from the body. Once ethanol is broken down into acetaldehyde that is known to be toxic and carcinogenic, it has to be further metabolized into acetic acid to eliminate in the body through urine. Alcohol use can affect all the areas of the body, but mostly it affects the brain, pancreas, heart, liver, and immune system. Alcoholism can result in health problems such as high blood pressure, inflammation of the liver, increased fat in the liver, cirrhosis, gastritis, pancreatitis, diabetes, osteoporosis, and dementia. So what are the differences between binge drinking versus alcoholism? Binge drinking is the most common, costly, and deadly pattern of excessive alcohol, and which most affects younger adults, aged 18 to 34 years old, but more than half of the total binge drinks are consumed by those aged 35 years and older. Furthermore, binge drinking is twice as common among men than among women. It involves consuming a large quantity of alcohol in a short period, resulting in intoxication. Typically for men, it is consuming about 5 or more drinks in about 2 hours, while for women, it's about 4 or more drinks in the same time frame. Binge drinking does come with its consequences, short and long term. In the short term, it increases the risk of alcohol poisoning, motor vehicle accidents, and STDs, to name a few. In the long term, it increases risk of liver disease, heart disease, cancer, as well as it increases risk for mental health issues like depression and anxiety. Most common cause of alcohol abuse is liver damage. Alcoholic liver disease includes 3 disorders that develop in sequence: alcoholic fatty liver, alcoholic hepatitis, and cirrhosis. And we'll talk about that in the next videos, so better stay tuned. But here's where binge drinking gets even more serious. Individuals who binge drink 5 or more times during a month are considered heavy alcohol users. Heavy drinkers have a significantly higher chance at developing alcohol use disorder, which simply means a dependence or alcoholism. But the good news is that despite the fact that heavy alcohol users have higher chance of becoming dependent, the majority of binge drinkers will not develop alcoholism, which means that your ability to stop when you feel like stopping is a little bit easier than those who become dependent. Alcoholism, clinically termed as alcohol use disorder, or AUD, is a chronic or long-term condition characterized by inability to control or stop drinking despite of negative consequences. It involves a prolonged and persistent reliance on alcohol. Individuals with AUD may find it hard to stop drinking, crave alcohol, and might experience withdrawal symptoms when not drinking. So there are 7 levels of being drunk that you may experience when drinking. Level 1, we have buzzed. The first effect from the alcohol are starting to kick in. You'll find yourself with a very light smile on your face and a warm sensation on your stomach. You'll still be able to walk and talk normally, but not for long. Level 2 is tipsy. At this point, you're starting to feel more euphoric. Shame levels are falling and your confidence is rising. You don't have to think as much when it comes to socializing. Level 3 is sloshed. This is when you start to feel more and more disinhibit when you lose your filter. Normally, when you're sober, the little person that lives inside your head kind of double checks everything you're gonna say before you say it. That way, you don't say anything stupid. Well, when you're drunk, that little dude just stops checking, so you're much more likely to say stupid things you wouldn't normally say. Another common side effect is you just kind of start to talk in all caps, and you may notice you have to pee a lot. They used to call this breaking the seal. As in, the first time you pee when you're drinking is when you've broken the seal, and now the floodgates are open and you're gonna have to keep peeing all the time. Level 4 is tossed. If you consume nicotine, this is you're gonna turn into Smiggle, looking for his precious vape. Also, loss of shirts is common side effect of the stage. If you're at a party and you see someone shirtless, they're tossed. Dancing also becomes easier. Level 5, yoast. You know the man that lives inside your head making sure that you don't say anything stupid? Well, you called in sick today, you're on your own now. When you're this drunk, pretty much every idea becomes a good idea. This is also when you start having momentary lapses in your memory. For level 6, we have hammered. Now, every friend group has one friend who known as a runner. When they get so drunk, they just decided to run away. If you're at a bar that has a stripper pole on the dance stage, it's time to get down. And finally, level 7, snap. Also known as, alright, who peed on my pants? This is when you'll get the spins where it feels like the whole room is spinning around, which can make you pretty nauseous. You also will probably not remember most. Alcohol is scary enough when consumed once in a moment, but inability to put it down is even scarier. How much you drink is no longer matters, but bigger question is how alcohol is affecting your life and your body. Alcohol doesn't solve any underlying issues you may have. If you are using alcohol to cope up with any mental burdens, try to find alternatives when it comes to this, in order to show yourself that there are other ways to navigate these emotions. Again, this is Shani, your friendly pharmacist, reminding you to drink moderately. And thank you for watching The Good Doctor. See you next time.
To proceed with free online consultation, click the link in the comments section.